Axonics Therapy starts with a simple test to experience the therapy firsthand. This test will determine if the therapy provides you symptom relief. You'll be able to try a temporary version of the therapy for a week or two while living your normal day-to-day life. First, a simple, minimally invasive procedure sets up the temporary therapy. A thin, flexible wire, called a lead, is placed in the body to allow for stimulation of the sacral nerve. The lead is then connected to a small, discrete external stimulator. The external stimulator can be worn under your clothing, and it generates the pulses that are delivered through the lead to the nerve. These pulses activate the sacral nerve, which is how the therapy can help normalize communication between your brain, bladder, and bowel. After the procedure, the stimulator will be set up so the pulses are comfortable and not bothersome. You'll be shown how to use a simple remote control in case you need to adjust your therapy during the test period. If you have any questions during the test, there is a dedicated support team to assist you. This includes your treating clinician, your local Axonics team, and the Axonics customer support team. You will need to avoid certain activities during the test, like strenuous exercise. This will be reviewed before and after the procedure. Your clinician may also ask you to complete a diary during the test to keep track of symptom relief. It's very important you track your symptoms if asked to do so. After your test is complete, you will discuss the results with your clinician to decide if your test was successful. A successful test is defined as a 50% or greater reduction in symptoms or a return to normal function. For example, if you were having bladder accidents 8 times a day, a successful trial would mean you had 4 or fewer accidents a day. If your test is successful, you can move forward with getting long-term Axonics therapy. Many patients have seen a significant reduction in their symptoms with Axonics therapy. In a recent study, 89% of patients with Axonics therapy found a greater than 50% reduction in their symptoms, and 80% of those patients had a greater than 75% reduction in symptoms. Your results and experiences may vary, as they are unique to each patient.